Hey, Dr. Lindsey and Wendy here. We're going to do a little video on, what is he, about a 35-year-old doctor who came in with short, fine blonde hair and a little bit pinkish skin and class 5, at least class 5 hair loss, roughly 18 months ago. And we did a little strip on him. Here's his before picture, and we packed him as tight as we could. And I think he's got another video. I'll try to put a link up of that.
He does have one, yeah.
And then we did a second case this past summer where we typically start right behind the first case and work back. And that's been 5 or 6 months ago, so that's probably just starting to grow. And then if you look at our video, it's entitled A Collection of Fine-Haired Patients. We talk about how, as tight as you can pack hair, when you have skinny hairs, it's never enough. And so at his second case, like most guys' second case, we put a few hundred singles right along the hairline. And so they have not yet started growing in. But he walked in yesterday, and he's now 19 months after coming in here, and 6 months after his second case. And he looks good. He looks younger, as you comment.
Yes, he does look younger. I was like, oh, you look younger.
So take a look at this short video, and then we'll talk about it.
He's, his curse. Your curse is, you're real white, and that's skinny hair, but that looks unremarkable. And you're a doctor. Did anybody notice that you had this done at work, or did you tell anybody? Or
not really. I just took some time off to let it heal, and after that, it wasn't that noticeable.
Good. And spin around and show me the back of your head there one time, and look up at the ceiling if you would.
So this is where we stopped.
Right.
Right there.
Yep.
And he's 6 months out from this.
And you were just saying you're just starting to feel like it's starting to grow.
Yeah, it feels like it's starting to fill in now.
Right. And lean down just a little bit so I can see your scar. Are you the guy that wants your stitches out at like 4 or 5 days or something like
yes.
that? Yes. Yeah. All right. Show me that scar, Wendy.
It heals.
Doctors can't deal with
No, he heals really quickly.
He does. That's awesome. That's twice in your head, and that's a little teeny scar. Any thing you think that people that are watching this video ought to know, or not, doesn't make any difference?
No, I mean, I'm happy so far with it. I think the recovery process is just, you have to be really patient with it, but as long as you have patience with it, you can get a good result.
And was that pretty honest with you? Bullshit here?
Yeah, definitely. You're very honest.
All right.
He looks better in person than what he looks in that video when the light hits that blonde hair.
Yeah.
And when you see him just...
Spin back around one time. And are you married? I can't remember.
Yes.
Is your wife happy with this?
Yeah, she's very happy.
Okay. That's probably more important.
Yes.
All right.
Doesn't hurt.
Thanks.
So he looks pretty good, don't you think, Wendy?
It looks very natural. It does not look like he had a hair transplant. It looks really good.
And he's pretty wound up like a lot of doctors are. He had us take out his stitches a day early.
He does heal fast.
He does heal fast, and his scar looks awesome, which is good because he wears that short doggone haircut. And I know I've seen a few threads on those forums about people with chronic redness. I have not seen that, but he's the kind of guy you're going to get red in. He's reddish complected, and was pink after this for probably week 4 to week 8. But now after week 8, pretty much everybody we've done, with one exception, and that was just a little bit pink. The redness is gone at week 8, and that's only in these Irish Catholic blonde guys. So. Yeah, I think you're right. He looks young. His wife's happy.
Yes, he says that was the most important thing.
Yeah, it always is. Keep the woman happy. Like I keep you happy here at the office, right, nurse?
Aye.
So to summarize, we took a guy with class 5 hair loss who's a medical professional and given him 2 strip cases, which has yielded an unremarkable hairline, excellent coverage that'll only get better over the next 6 or 7 months till we see him back for a final time.
When you see that video, when I'm combing it, I mean, there's hair on every little space there.
Yep.
And when the light hits it, so people might think, oh, it looks thin, but it looks really good, and in person, it looks even better. Yeah.
That's just under incandescent office lights. We don't have a studio where we do those little videos. So, if Wendy and I can help you or have questions, please give us a call. Thanks.